4.8 million, or approximately 20% of the population, have a mental health or behavioural condition. 2.6 million, or approximately 11% of the population, have mood disorders. 1 in 10 people have depression. 1.2 million, or approximately 6% of the population, have both anxiety and depression. And 30% of people aged above 85 years have dementia. It's predicted that dementia will become the leading cause of death in Australia in several years' time, surpassing the death rate caused by heart disease. There is growing evidence that certain dietary strategies and nutrients may be beneficial or detrimental to mental health conditions such as depression and anxiety. Current scientific evidence has found the following. Firstly, increased consumption of a diet high in fruits, vegetables, fish and whole grains has been linked to a lower risk of depression. Secondly, adhering to the Mediterranean diet has been linked to a lower risk of depression. The low carbohydrate ketogenic diet has been shown to be effective in the control of seizures in many children with epilepsy. Fourth, deficiencies in vitamins, including vitamin B12, thiamine, niacin and folate, may lead to cognitive dysfunctions. Fifth, a healthy diet rich in good polyunsaturated fats and supplements that include vitamins have been shown in some studies to exert favourable effects on cognitive performance, mood and stress. In contrast to dietary aspects that might promote improved mental health, negative mental health effects such as increased risk of chronic depression has been linked to higher intakes of processed foods, higher intakes of added sugars, higher intakes of refined carbohydrates. Now, while we can talk at ends about the potential impact of diet on mental health, we can't dismiss the impact of poor mental health on our dietary choices. There is no doubt that stress and uncomfortable emotions prompt us to reach for sweet and fatty foods. And in the short term, these types of foods may actually reduce the stress response. However, in the longer term, they can have negative effects on our mental health. Experiments conducted in animals suggest that foods high in saturated fat and refined sugars are addictive. They interact with our dopamine system in the way that other addictive products do. And therefore, a short-term strategy to cope with stress may involve increased consumption of a high-fat, high-sugar diet, as it does have some temporary antidepressant and anxiety-reducing effects. However, such a diet in the longer term carries the risk of worsening both mental and physical health. So, given this bi-directional relationship between poor mental health and poor diet, we need to consider that it is perhaps most fruitful to comprehensively target both diet and mental health using additional mental health strategies in order to improve our overall well-being and health. Researchers now believe that depression is not just a brain disorder, but a whole body disorder. In fact, mental and physical health are really two sides of the same coin. Some potential underlying reasons a good diet may improve depression and mental health include, firstly, improving inflammation. Patients with major depression have been found to have increased levels of inflammatory compounds in their blood, many of which can gain access to the brain and interact with virtually every domain there known to be involved in depression. Furthermore, activation of these inflammatory pathways within the brain is believed to contribute to effects that may promote damage and dysfunction. A good diet that contains more anti-inflammatory agents and less pro-inflammatory agents, so for example a diet high in fruits, vegetables, fish and whole grains, but lower in processed foods, saturated fats and added sugars, may reduce inflammation and depression risk.